Yeah, we'll continue the further part of it. So ನಾನು ನಿಮಗೆ ಗ್ರಾಮ್ ನೆಗೆಟಿವ್ ಬಗ್ಗೆ ಹೇಳಿದೆ, ಆಮೇಲೆ ಇದ್ರ ಬಗ್ಗೆ ಎಲ್ಲ ಹೇಳಿದೆ. Now let us see what is available filters in the market. So there are filters like you have 20 micron. ಈ ಎಲ್ಲ ಬ್ಯಾಕ್ಟೀರಿಯಾ ವೈರಸಸ್ ಅನ್ನ ಹಾಸ್ಪಿಟಲ್ ಒಳಗಡೆ ಬಿಡಬಾರ್ದು. ಈ ವೈರಸಸ್ ಬ್ಯಾಕ್ಟೀರಿಯಾನ ಹಾಸ್ಪಿಟಲ್ ಇಂದ ಹೊರಗೆ ನಾವು ಹಾಕ್ಬೇಕು. ಸೊ the one benefit of it is you will have lesser cross contamination. Patient hospital length of stay ಕಡಿಮೆ ಆಗ್ತದೆ. ಒಂದು 10 ದಿನ ಇರಾವ, ಒಂದು 4 ದಿನಕ್ಕೆ ಡಿಸ್ಚಾರ್ಜ್ ಆಗಿ ಹೋಗ್ತಾನೆ. ಡಾಕ್ಟರ್ಸ್ಗೂ ಹಿಡಿಯಕ್ಕಿಲ್ಲ, ಅವರು ಆರಾಮ್ಸೆ ಇರ್ಬೋದು. ಸೊ ಇವಾಗ ಅದನ್ನ ನೋಡ್ಲಿಕ್ಕತ್ತಾಗ ನಾವು ಲೆಟ್ ಅಸ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಏನೇನು ಫಿಲ್ಟ್ರೇಷನ್ ಅವೈಲೇಬಲ್ ಇದಾವೆ. 20 ಮೈಕ್ರಾನ್, 10 ಮೈಕ್ರಾನ್, 5 ಮೈಕ್ರಾನ್, 3 ಮೈಕ್ರಾನ್, 0.3 ಮೈಕ್ರಾನ್, 0.1 ಮೈಕ್ರಾನ್. 0.1 micron vargunu we have a filters available which are readily available in the market, which we can utilize it in our daily routine, provided you have a proper thickness of the filter, proper surface area and proper calculation. So ಇವಾಗ ನಾವೇ ಕ್ಲೀನ್ ಏರ್ ಅಂತೀವಿ ಅಂತಂದ್ರೆ, ಕ್ಲೀನ್ ಏರ್ ರೀಸನ್ ಏನು ಅಂತಂದ್ರೆ, there are hospitals which operate their entire operation theaters and ICU and even the critical areas also with a split AC, cassette ACs, fan filtration units, ceiling suspended units. ಇವೆಲ್ಲನೂ ನಿಮ್ಗೆ ಕೂಲಿಂಗ್ ಅಷ್ಟೇ ಕೊಡ್ತಾವೆ, ಬಟ್ ಏರ್ ಫಿಲ್ಟ್ರೇಷನ್ ಏನೂ ಇರಂಗಿಲ್ಲ ಅದ್ರಾಗ. ಸಿ ನಾವು ಸ್ಪ್ಲಿಟ್ ಎ ಸಿ, ಕ್ಯಾಸೆಟ್ ಎ ಸಿ, ಫ್ಯಾನ್ ಫಿಲ್ಟ್ರೇಷನ್ ಯೂನಿಟ್, ಸಿ ಎಫ್ ಯೂಸು ಮ್ಯಾಕ್ಸಿಮಮ್ ಎಷ್ಟು ಇರ್ತಾವೆ ಅದ್ರಾಗ? 20 ಮೈಕ್ರಾನ್, 10 ಮೈಕ್ರಾನ್, ರೇರೆಸ್ಟ್ ಟು ರೇರ್ ಕೇಸ್ 5 ಮೈಕ್ರಾನ್, ಅದು ನಾನಂತೂ ನೋಡಿಲ್ಲ. ಸೊ ನಾವು 5 ಮೈಕ್ರಾನ್ ಫಿಲ್ಟರ್ ಇರ್ತದೆ. Now imagine when you use split AC, when you use cassette AC and all these ACs, now where these are the contaminations which are brought by patients who are going to visit your hospital. These are the bacteria which are living with us. They are next to us. ನಮ್ಮ ಹೊಟ್ಟೆಯಲ್ಲೂ ಬ್ಯಾಕ್ಟೀರಿಯಾಸ್ಗಳಿದಾವೆ, ಚಲೋ ಬ್ಯಾಕ್ಟೀರಿಯಾಸ್ಗಳಿದಾವೆ, ಬಟ್ ಈಗ ಇವೆಲ್ಲ ಸುತ್ತಮುತ್ತಲಿ ಇರ್ತಾವೆ. ವೆನ್ ದೇ ಆಕ್ಟ್ ಅಪಾನ್ our body, when our immunity reduces, when we are more susceptible, these are going to attack you like a military. When our military comes down, then the external other inimical countries, they'll attack on us. So that is how these are the contamination which will act upon our organisms and our tissues and then create a problem to us. This is the germ theory. Okay, so now when patients are visiting hospital to get treated, when patient come to hospital to get treated, they bring certain contamination with them, they bring certain problems with them, they bring, because they already their loads are increased, the bacterial load is more, the virus load is more, spores is more. Now they visit a hospital, they cough, they sneeze, the droplet will come out, they fall to the floor, and then after that what will happen, they over a bit of become airborne. ಯಾರೋ ನೀವು ಹೋಗಿ ಕೂತ್ಕೊಂಡಿರ್ತೀರಾ, ಚೇರ್ ಮುಡ್ತೀರಾ, ಆಮೇಲೆ ಐಸಿದಲ್ಲಿ ಒಬ್ಬ ಸ್ಟಾಫ್ ಇರ್ತಾಳೆ, ಶಿ ವಿಲ್ ಡೂ ಹ್ಯಾಂಡ್ ವಾಷಿಂಗ್ ಅಂಡ್ ಅವನು ಹೋಗ್ಬಿಟ್ಟು ಬೇರೆದವ್ರಿಗೆ ಮುಡ್ತಾರೆ. ದೆನ್ ದೇರ್ ಕಂಟಿನ್ಯೂಸ್ ಕ್ರಾಸ್ ಕಂಟಾಮಿನೇಷನ್ ಡೂ ಹ್ಯಾಪನ್. ಸೊ ಅದನ್ನೆಲ್ಲ ತೆಗಿಯೋದು ಹೆಂಗೆ? ಇಫ್ ಯು ಆರ್ ಆಪರೇಟಿಂಗ್ ವಿತ್ ಸ್ಪ್ಲಿಟ್ ಎ ಸಿ, ಕ್ಯಾಸೆಟ್ ಎ ಸಿ, ಫ್ಯಾನ್ ಫಿಲ್ಟ್ರೇಷನ್ ಯೂನಿಟ್, ಸಿ ಎಫ್ ಯೂನಿಟ್ ವಿಚ್ ಹ್ಯಾಸ್ 20 ಮೈಕ್ರಾನ್, 10 ಮೈಕ್ರಾನ್, ಹೌ ಯು ಗೋನ್ ಟು ರಿಮೂವ್ ಆಲ್ ದಿಸ್? Because of which what will happen? The contamination stay there itself. It will not go out at all. How many times you are going to do fumigation? You will do fumigation. Again, it's a problem. ICU, OT, you are going to do fumigation. What about ICU? One patient irtare. You don't have any multiple ICUs like 10 medical ICUs where if I'm going to vacate this particular ICU and shift it to some other ICU. No, it's not possible. How are you going to fumigate your ICU? Rarely once in a year they are going to make a grand cleaning. But one ವರ್ಷದ patient admit ಆಗಿದ್ದ. So ಅದಕ್ಕೆ ಮಾಡುವಾಗ ಸೆಟ್ಟಿಂಗ್ಸ್ ಅನ್ನ we have to make in such a way that we have to reduce as much as possible these loads, and which is evidenced. You can reduce, you can do swab cultures, you can reduce your air particle, you can do air particle counter, and then make sure that you have, see, for all this, until unless you have some media. What is that media? The air particle. Until unless you have an air particle, these cannot travel from one area to another. ಅದಕ್ಕೆ ರೆಕ್ಕಿ ಇರಲ್ಲ, ಬ್ಯಾಕ್ಟೀರಿಯಾಗೆ ರೆಕ್ಕಿ ಇರಂಗಿಲ್ಲ, ಹಾರ್ಕೊಂಡು ಹೋಗಂಗಿಲ್ಲ. ಅದು ವೈರಸ್ ರೆಕ್ಕಿ ಇರಂಗಿಲ್ಲ, ಅದಕ್ಕೆ ಇಟ್ ರಿಕ್ವೈರ್ಸ್ ಅ ಮೀಡಿಯಾ. ಆ್ಯಂಡ್ ದೇರ್ ಆರ್ ಪಾರ್ಟಿಕಲ್ಸ್ ವಿಚ್ ಆರ್ ಫ್ಲೋಟಿಂಗ್. ಹೋಗ್ತೀರಿ ಐಸ್ನಾಗ ಫ್ಯಾನ್ ಹಚ್ತೀರಿ, ರೂಮ್ನಾಗ ಫ್ಯಾನ್ ಹಚ್ತದ, ಯಾವುದೋ ಒಂದು ಡೋರ್ ತೆಗಿತೀರಿ, ಅಲ್ಲಿಂದ ಏರ್ ಗಶ್ ಬರ್ತದ, ಏರ್ನ ಇದನ್ನು ಸ್ವಿಪಿಂಗ್ ಮಾಡ್ಕೊಂಡು ಹೋಗ್ತದೆ ಕಂಟಾಮಿನೇಷನ್ ಎಲ್ಲ. ಸೊ ದೀಸ್ ಆರ್ ದ ಥಿಂಗ್ಸ್ ವಿಚ್ ಹಾಸ್ಪಿಟಲ್ ಶುಡ್ ಫೋಕಸ್ ಅಪಾನ್ ರಾದರ್ ದೆನ್ ಆಸ್ಥೆಟಿಕ್ ಪಾರ್ಟ್ ಆಫ್ ಇಟ್. ಬಿಕಾಸ್ ದ ಹಾಸ್ಪಿಟಲ್ ಮೀನಿಂಗ್ ಇಸ್ ದಿಸ್. ಹೆಲ್ತ್ ಕೇರ್ ಸೆಟ್ಟಿಂಗ್ ಯಾಕೆ ಹಿಂಗಿರಬೇಕು ಅಂದರೆ ದೇರ್ ಆರ್ ಸರ್ಟನ್ ಗೈಡ್ಲೈನ್ಸಸ್, ಹಿಂಗಿರ್ಬೇಕು ಹಾಸ್ಪಿಟಲ್ ಅಂತಂತ ಹೇಳಿ. ನಾವು ದೇರ್ ಆರ್ other things have come up in the market. I would say that subject knowledge illa antandage enaagtati, these are the things will float around. So there is something called using the fan filtration unit in the operation theaters with less microns. Ask what are the level of filtration that you are maintaining. Let us understand there are another way why we categorize into why we require laminar flow, why we require these kind of filtrations. See, there is one more thing which has come up in the market, that is called as ductless AHU. Okay, can you just imagine ductless AHU? So why we require laminar flow? See, this is the top portion, that is the sealing part, and surgeon is standing here. Air comes from here and sweeps, go back to the main system. Why this air curtain is needed? Because surgeon is a patient is sleeping here. Why this air curtain is needed? Because already you are into a clean zone, they are making one more clean zone here. Particles are already 7, as per ISO 7 classification, particles are already less. So in that again you are creating air curtain where surgeon is going to safely, like in cocoon, he is going to practice and he is going to cut open the skin, do all surgery here. So you will have very minimal air contamination that is happening here, because air is coming all the time till the surgery gets over. Okay, so now because of which what will happen, you are under the air curtain. That's the reason where even international standards and all that, they are even Indian standards also, they are requesting you to go ahead with the laminar flow minimum. Even though I don't agree with the standards they are laid down in terms of air changes per hour, but at least do something. Do not operate with the split ACs. Reason is you have split AC somewhere in the corner, you will get cool. Surgeon is very cool. Agreed. He's healthy. The staffs are healthy. Now what about patient? He's already come with some problems. His immunity is low. He is susceptible. He may get some other infection because already other patients got admitted there and discharged, a lot of contaminations there in the ICU or critical area itself. How are you going to take it out? Not possible. So now this is what it is. Now the new thing what has come up is ductless AHU. I'll explain to you on that. I have told you what is the purpose of laminar flow, and there are multiple level of filtration that happens. See, now this is 0.3 micron. Beyond 0.3 micron, there will be a big machine, very big machine. We're going to have there 20 micron, 10 micron, 5 micron, 3 micron, and sometimes we have used in projects even 0.3 micron there and 0.1 micron here. So now these passes through activated carbon filter, multiple level of filtrations are there, and then it will come to the OT. Now imagine if you have one I would say ductless AHU, what they are going to do is, this is a ceiling, they are going to put one machine on top of your OT itself. Okay, now there is going to be a dummy grills here. Air comes from here and goes out, and then coming from here goes out like a circle. There will be a cooling coil, outside there will be one unit kept. It gives you enthalpy, gets into cooling coil, there will be a motor here, it sucks from here and give it back to you. First of all, the level of filtrations get compromised and you will have a turbulent airflow, not even a laminar. But those OTs will have SS wall, SS ceiling, imported vinyl, and aesthetically perfect. But what is the purpose of operation theatre? You have to have a clean air. That is lost. This is the reason why I tell you that hospital industry should understand that aesthetics one end, functionality the another end. If it goes with the balance, I agree. If you spend more in terms of aesthetics, then patient get affected. Long run, even in short run also, which sufferer only will be able to explain to you. And if you spend more towards the aesthetic part of it, then what will happen? You will no money left out at the time of hospital commissioning, that if you suggest to go with some betterment, budget constraint. And if you do more in terms of clean air and environment and then best hospital infrastructure, then what will happen? Patient has to be also wise. Patient also should understand, you are going to a hospital to get treated. If you are interested for better aesthetics, there are good hotels you can definitely go and then enjoy that ambiences. But hospital facility one should look for. I'll tell you what all things you should look for in the hospital over a period of time, because that is given a guidelines in accreditation guidelines. So patient rights and responsibility, those chapters comes in patient. What is the patient right and responsibility? What is the hospital rights and responsibility? So you aim for a hospital where it has a better doctors, better ICU settings, operation theatre settings, proper safety. Then you focus upon the ambience and aesthetic part of it. For you have to discharge little early from the hospital. Now these are the ductless AHUs, and you have fan filtration unit putting into a system saying that it is going to give you a proper. No, you have to get your validation report, a proper validation report, not immediately after opening up a hospital or opening up the ICU. You have to get your validation report when everybody are there. You have to get your validation report when surgery is happening. You have to get your validation report after 1 year, 2 year of functionality. Then you will understand what is the particle that I'm going to bring in. So now whenever, see, I'm going to end this subject here. I just wanted to tell you that these are the contaminations, and they are going to harm us. Somehow we have very good treatment available, so we are thankful for our antibiotics and timely response of all our wonderful sirs and doctors. So now let us understand, now this is regarding the what is the purpose of having a proper air inside the hospital, and then don't get it shorter ways of getting into accreditation guidelines. Get validation reports, proper validation reports. Okay, so now I have explained in terms of all this, and then again further in coming sessions I will try to talk about another new topic. So one by one I try to cover up healthcare subjects. Thank you.